I'm Dr. Douglas Paul. I'm the Medical Director of Trauma Services and Acute Care Surgery at Grant Medical Center in Columbus, Ohio. A Level 1 Trauma Center verification from the American College of Surgeons indicates that you are providing care at the highest level possible in the United States. We have over 200 specialists and physicians waiting at a moment's notice on call to respond to any and all injuries. We have trauma surgeons who are devoting their careers to the care of the trauma patient in-house, ready 24 hours a day to be in the trauma bay within minutes. The entire system is set up to care for the trauma patient from pre-hospital to disposition and rehabilitation facilities. And we are very excited to be ready for our next verification in December of this year. We've been described at our last verification as a model trauma program by the American College of Surgeons. Our most common etiologies of injury that come to Grant Medical Center are the result of motor vehicle crashes and falls. We also see motorcycles and assaults and some penetrating trauma with gunshots and stab wounds, but clearly motor vehicle crashes and falls and motorcycle accidents are the highest number of patients that come to Grant. We see trauma patients from 3 different states, West Virginia, Kentucky, and Pennsylvania, and 50 counties within the state of Ohio. We have an excellent relationship with the EMS community, and we have patients flown by air medical transport. We have patients brought by ground transport, and also families and friends occasionally drop somebody off to us. So we have a very wide catchment area from central Ohio down to the borders of the state. When patients ask what they can do, I always say common sense. And common sense is something that we need to utilize a little bit more in our society. Trying not to drink and drive, text and drive, drive distracted, driving a motorcycle without a helmet, looking around the home for fall areas, especially in the geriatric patient population, following the speed limit signs, watching for red lights and stop signs, and making sure that we're not consuming alcohol while we're driving. Last year at Grant Medical Center, we admitted 3,700 patients to the trauma service, saw over 4,500 patients. We're very busy, growing at about a 2 to 3% clip per year. Our growth plans include the addition of an acute care surgery program in which smaller hospitals whose capabilities might be exceeded by a patient's illness can utilize us to send them right to us to the intensive care unit. As the critical care surgeons in the hospital, we can admit people to the ICU, do all of the care, and bring in our colleagues to assist us with any needs we might have, whether it would be vascular, cardiothoracic, etc. Well, re-verification, as I said, occurs every 3 years, but we approach every day as verification day. We're very concerned about doing the right thing on a daily basis, and if you do the right thing on a daily basis, you don't have much to worry about with re-verification. We have a highly trained team of personnel that records over 150 data points on each patient. We follow those, we trend those, we meet on a monthly basis with everybody that touches a trauma patient in the hospital and make sure that we're doing the right thing and following the guidelines and protocols that are set in place for a level 1 verification to occur.